Good day. My name is Petra Bryzovitz, and I'm a professor in nursing at the University of KwaZulu-Natal in Durban in South Africa. Thank you very much for the opportunity to speak to you today about nursing in South Africa. So I just wanted to show you where I am from. So if you look at the map of Africa, South Africa is right down at the bottom. And if you look at the arrow, that's where Durban is, on the east coast of South Africa. So I have a few pictures here just to show you what my city is like. There are lots of beautiful beaches, and it's quite a big city in South Africa. So just to tell you a little bit about South Africa, we have an estimated population of 54 million, and we have a relatively young population. You will see that 30% are ages 15 years or younger. Our life expectancy over the last few years has really increased quite dramatically, as you can see from the slide. And that has a lot to do with the fact that a large proportion of our population were HIV positive. And since the introduction of antiretrovirals, that's done a lot to increase the life expectancy. I put this slide here as well from the WHO, just to be able to give you a bit more information about South Africa. And you can take a look at the life expectancy of males and females, always something that's important to have a look at in terms of health. And then just the general sort of expenditure on health per capita. It's a very useful way of being able to obviously compare countries. So if we look at the main causes of death in South Africa, unfortunately, South Africa is said to face a quadruple burden of disease. So we have a large problem in terms of communicable diseases, and quite specifically HIV, AIDS, and TB. They are very large problems for us. Maternal and child mortality is also one of the major causes of death. And then, like most countries in the world, the non-communicable diseases such as hypertension, cardiovascular disease, diabetes, mental illness also play a large part in the main causes of death. And unfortunately, we have a large problem in terms of injury and trauma. And actually, that is really a lot of where my sort of focus lies as a nurse academic. So I've just sort of broken this down a little bit more specific, and you'll see that tuberculosis and HIV play a fairly large role. And then the diabetes, cardiovascular disease, heart disease, that many countries in the world are experiencing difficulty with, is also right up there as one of the main causes of death for us. We have some issue in certain parts of the country with waterborne diseases, cholera, gastroenteritis, typhoid, and also malaria is a problem in some small areas in our country as well. I thought that this would be a useful slide just to show you in terms of the number of deaths. And this is information from 2015. And as you can see, tuberculosis is a major problem for us. Our road traffic accidents, then HIV-related AIDS deaths, and malaria. I put this up because I think it's very interesting slide, and unfortunately very bad for us that, as it says, the chances of dying in a road traffic crash depend on where you live. And unfortunately, Africa is one of the worst places, and road traffic fatalities are indeed a big problem for us. I also just wanted to highlight the number of nurses per 10,000 population by region. And if you see at the top, colored in yellow, Africa has the least amount of nurses. And obviously this creates big problems for us in terms of how we manage the health of our population. So let me explain a little bit about the different categories of nurses that we have in South Africa. We predominantly have these sort of 4 different categories, as you can see on the slide. The first one is an enrolled nursing auxiliary, which is somebody who's had training for a year and really does a lot of the sort of feeding, cleaning, assisting patients in the various healthcare facilities. The enrolled nurse is somebody who has 2 years of experience, and this is a nurse that does a lot of the normal kind of nursing tasks, but works under the direct supervision of the registered nurse or the professional nurse. In South Africa, our registered nurses or professional nurses have a program that is 4 years long. And then after that, you can go on to do various specialist training. And those training programs are around 1 to 2 years. It really just depends on which sort of program you are doing. So in South Africa, as of last year, there were more than 400,000 registered nurses, professional nurses in South Africa. So nurses in South Africa make up the majority of the health workforce, and nurses comprise of almost 65% of the healthcare workers in our country. And in many cases, they are the first point of care for any patient who is needing treatment. And nurses are really seen as the backbone of the healthcare system. So if I tell you a little bit more about the professional nurse education program, you have an opportunity, if you're wanting to be a professional nurse in South Africa, to either do a university program or to do a diploma program, but whichever you choose, it will take you 4 years. After those 4 years, we are then registered with our South African Nursing Council, and we are registered as a general nurse, a community health nurse, a psychiatric nurse, and midwifery. Due to the complex health needs of our country, it was decided that professional nurses need this kind of comprehensive training in order to be able to deal with all the different patients that we are exposed to. We have 23 university nursing departments that offer training in South Africa, and these go from undergraduate right through to doctoral level. And I am a staff member at one of these in KwaZulu-Natal. We also have numerous state and private nurse education institutions, and they offer the diploma program. It's also just important to note that, especially in the university programs, we have always had male nurses, but now over these sort of most recent years, the number of men who are choosing to come into nursing is definitely increasing in South Africa. I put this slide up just to show you the different specialty areas of nursing in South Africa. And I'm sure you can see that it's quite wide and varied, like most countries in the world. We have a wide variety of post-basic specialist areas that you can train in for nursing. We also have something called compulsory community service, and it's actually for all health professionals, but it started for nurses in South Africa in 2008. And it was really in response to the challenge of limited human resources in the healthcare sector. So every registered professional nurse On completion of their program, be it a diploma program or a university degree, is then required to do 1 year post-completion training. I thought it would be interesting for you to see an approximate description of the professional nurses' salaries in South Africa. So when our newly qualified nurses do their community service, they do receive salary for that year, and I've just converted it into US dollars. And then I've also put the entry-level salary for a professional nurse so that you can have a look and compare it to your own country, perhaps. So a little bit about my university, where I am a staff member. The University of KwaZulu-Natal was formed in January 2004. So it's a relatively new university, but it was the result of a merger between two older, very well-established universities, the University of Durban-Westville, which had been in existence since the 1960s, and the University of KwaZulu-Natal, which had been established in 1910. So there were two very old universities that then came together to become the University of KwaZulu-Natal. And if you have a look at the pictures on the bottom, the second picture from the left is Howard College campus, and that's where I work. Just put up a number of photographs here of some of our students doing some of their community health work. You can see the mental health students doing something about autism. And then also a few pictures of our staff interacting with the students. And just to give you an idea of who we are. So in our nursing discipline at the University of KwaZulu-Natal, we have 21 academic staff. And we have two sort of undergraduate programs. One of them is the Bachelor of Nursing. And at present, we have 342 students in that program. We also have some post-basic, some specialist programs for registered nurses. We have a large amount of postgrad students, 122, and you can see a large proportion of those, 71% are PhD or doctoral students. So our department is one of 4 World Health Organization collaborating centers for nursing and midwifery education in Africa. And we actually became a WHO collaborating center in 1998. And so we have a very long history in our department of collaborating with the WHO and strengthening nursing and midwifery workforce leadership education throughout Africa. And we offer a wide range of undergraduate and postgraduate programs. And we have also been very instrumental in helping to establish a variety of these programs in different African countries. Myself, I've been through to Tanzania, to Rwanda, to the Seychelles, to a various number of countries in order to do this. So just a few words about the impact of COVID on our department, and I'm sure it's been very difficult for you in your country as well. We had this huge shift in operations, having to now go into e-learning, having to do remote teaching, thinking about how we were going to try and assist our students in learning various clinical procedures. We also have the added problem that a lot of our areas do not have sufficient internet access. People do not have computers. So it was quite a challenge. We have, however, managed to overcome that, and we're doing fairly well with our online teaching at the moment. We also started something called virtual ward rounds, where we're using simulated patients from our clinical skills laboratory, and that's being recorded and then distributed to the students to aid with their learning. We have a really nice, a really big clinical skills laboratory where our students usually master their clinical skills. But because of all the COVID restrictions, we can only have 7 students in the laboratory at a time, which obviously makes it quite difficult to try and get through all the students and give them time there. We also had to withdraw our students from the clinical settings for a period of time due to the pandemic, and then had to reinstate the students. The students had to go through quarantine for 2 weeks. We had COVID testing. We also had compulsory modules that we made them do in order to try and ensure that they were able to safely work in the clinical area and make sure that they looked after their own health. Making sure that there was sufficient PPE for the students in all the clinical settings also took quite a lot of organization. We had, and we still continue to have, a lot of Zoom meetings with lecturers and student support services and with clinical psychologists for our students, because a lot of them were really quite reluctant and very nervous about going into the clinical area. And they're still being taught and supported virtually. So just a few words about the unique aspects of nursing in South Africa. I think that one of the things is that it's a very wide and diverse healthcare system. We have the state healthcare system that the vast majority of patients access, and then we also have private medical health insurance, which caters for a small majority of a small number of the population. And so we have patients that have cholera, typhoid, and those that are perhaps undergoing heart and lung transplants, actually all quite close in an area. And sometimes it's quite amazing just to think how diverse things are within a small space. So our students really have exposure to often caring for patients in first world conditions as well as third world conditions. And so a nurse has the opportunity in a day to deal on and to work with these sort of extremes of health and illness. And thus our nurses require a vast span of skills. And I think that having such a clinical environment and honing our clinical skills so well is perhaps one of the things that makes South African nurses seen very attractively in the rest of the world. People are usually very willing to have a South African nurse come to their country. So for me, I think what makes it unique is that we are often working in a low resource, multicultural environment. South Africa is famously referred to as a rainbow nation, and that's because we're made up of so many diverse cultures and religions. And on this slide, I've just tried to illustrate just a little of that. We have 11 official languages, which sometimes can make it quite challenging, but that just sort of serves to showcase how diverse we are. This is also just to show you how some of our nurses are working in very rural, marginalized areas, maybe just a very simple kind of health clinic with very few resources. And then other nurses are working in highly sophisticated areas with all the top state-of-the-art technology that you would find anywhere in the world. So we have our challenges. We have sort of a very bad distribution of nurses between rural and urban areas. Most of the nurses want to be in the urban areas. We have staff shortage. People complain that nurses have lost their caring sort of ethos. There's a gap that's said to exist between the professional competencies and the actual priorities. So are we really sure that we're teaching them what they need currently in the clinical area? And nursing is an aging profession. And I think that's a problem in many countries in the world. So just to show you here, if you look at the ages of our registered nurses, our enrolled nurses, and our enrolled nursing auxiliaries, that we can see that we're heading for a problem in a number of years to come. And there really is a need to attract and retain younger nurses into the profession. So just to finish off with success stories, so I think that one of the ways that South African nurses have really made an impact in health in South Africa is around these nurse-initiated antiretroviral treatment. And I think that's made a huge, it's had a huge impact on how we manage HIV positive patients in South Africa, and something that we're very proud of. And then our nurses also play a huge role in leading primary healthcare in South Africa. And sometimes nurses are working in very small, marginalized, remote clinics, and they are the ones that are solely responsible for the health of the community around them. I think we've all seen that during the COVID pandemic, nurses have played a crucial role, and definitely here in South Africa, they've been recognized for that role that they've done and that they continue to do. Unfortunately, what we've also seen is that our nurses also, amongst all the other healthcare workers, are the ones that have the highest level of distress, of emotional, psychological distress. And so we know that this is probably going to be an area that's going to need attention in the future. Just to say that in South Africa, we're very grateful for everything that our nurses do in all the different spheres that our nurses are operating in, as around the world. And I myself am very proud to be a nurse and be part of that population. So that's all that I have to tell you for today. Hopefully it's given you a bit more insight into nursing in South Africa, and thank you very much for your time.